Okay, Dr. Donut here. We're just going to talk about injection of Kybella. So Kybella is a new injectable for submental fullness. So as opposed to needing surgical procedure for any kind of fullness beneath the chin, you can use a new injectable that's just recently been FDA approved. And it can address candidates like this where there's very little fullness. Tilt your head down just a little bit for us. There's really not much fullness there. She's young, she doesn't have a lot of looseness of the skin. She doesn't have big platysmal bands. Go like this for me, just make your neck muscles stand out. So these platysmal bands here, if they were real prominent, good. If they were really prominent in someone typically a decade or two older, then you have to be a little bit more careful about doing this kind of treatment because it could just skeletonize those bands. So if that were the case, you'd want to do something more like a cementoplasty or a little procedure where neck lift, some call it. Do a little incision here and tighten the neck muscles as well. But she's a great candidate for doing this because if you tilt down just a little bit, and a lot of patients will do that. They come in and they'll have their chin up, but usually this is more the position that they're in on a daily basis, and it's a more natural position. So that shows what they want to get rid of anyway. So just a slight fullness in here. A couple things we have to consider in addition to the looseness of the skin and any neck muscle banding would be that there's a nerve that comes this way that we're very used to dealing with in facial plastic surgery because in doing facelifts we're careful to avoid that. And so that comes down here and it courses just within about a centimeter or two of the jawline. So we have to make sure we stay below that. So it's not good for jowls, reducing the fullness in the jowl. That's still going to be a better procedure for traditional, very, very fine focused liposuction with a very small cannula, maybe this size. So, and that's what we can do for the neck anyway if there's someone who has more significant fullness or has the downtime for it. But this, on the other hand, can be done right here in the office, as we'll show you. So that nerve that I was talking about is called the marginal mandibular nerve, and it comes just down here, and it controls the lower corner of the mouth. So if you were to go like this, so it kind of controls that movement, and then if that were to be weakened, then when she were to purse, this side wouldn't move as well either. So we'll mark her up, and then we'll be back in just a few minutes to do the injections. Okay, so we put the grid on here with the little markings that are about a centimeter apart, and if you tilt up just a little bit, we'll be able to show how the grid is on here. It's just a temporary little skin marking grid, and then I outline the area that I wanted to do. Don't even need to get over here for her. She really doesn't have any really adipose tissue over there, so that's good. And that keeps us away from the area that we talked about before, where we are concerned about the nerve anyway. So we'll just focus on this area here. It looks like she'll probably need about 14 little spots that we're going to inject, and it's about 0.2 cc's per spot. So that's about 2.8 cc's, which is about a vial and a half, approximately, of the Kybella. So we'll get the Kybella together and get ready to inject. Okay, all set to go, and we've got it drawn up in 1 cc syringes, and I'm just going to put 0.2 cc's in each little spot here. We'll start at the top of it here, and she's been numbed with topical numbing medicine and a little bit of ice that she's had on there, and that's why the skin's a little bit red. So we'll just start right in this area here. 1, 2, and 3. 1, 2, 3. 2, 3. 'Use a little bit of air to get that last little bit out of the syringe. Put a little pressure there. So continuing on now. 1, 2, 3. 1, 2, 3. Just trying to get just into the subcutaneous layer. tiny bit of blood there. Good. And a little pressure, and we're done. Wasn't too bad, I hope?
No.
Good, good. Okay, so as we talked about, you'll probably just want to ice for 20 minutes or so afterwards, and maybe this evening, 20 minutes on, 20 minutes off if it feels better, and then come back in about a month, we can do another one. Okay, great, thanks. Thanks very much. All right, so we just want to show immediately afterwards, it just feels slightly firm to her, but as you can tell, it's not too swollen. It may swell over the next couple of days. That's something that you can expect a little bit of swelling. It's not usually too bad, and it can be covered with a little scarf if you wanted to. Really no significant activity limitations tonight. Just I would take it easy. No heavy exercise or anything like that. Walking is fine, but you're mainly probably just going to want to ice it some.